All right. Thanks, guys, for coming. Thank you, everybody. So this is a procedural kind of train the trainer session. So we're going to have a fun day where and this is sponsored by the SIM Academy. So most of this was the brainchild of a bunch of members of the SIM Academy. And it came about because we wanted to teach procedures, but then we also wanted to teach people how to teach procedures because there's a huge depth of information there to learn how to convey. I'm Alise Frallicciardi. I'm from the University of Connecticut. I'm the SIM director there and the going out president of the SIM Academy. So today we have a fun day planned for you. We have a boatload of super amazing instructors who are beyond qualified, and I should be a learner in this room rather than a instructor today, just from the amount of brain power that's in here. We have a ton of instructors. I was going to have you guys introduce yourselves, if that would be okay. I should have made you wear t-shirts that all match so we could figure it out in this room, but we'll learn that for the next time we put this one on. So we have a bunch of instructors. You guys want to introduce yourselves? The instructors?
I'm Christopher Strother. I am at Mount Sinai Hospital in New York City, and I'm our Director of Simulation for the Medical School, the Emergency Department, and the Director of Pediatric Emergency Medicine there.
I won't hit the chair. Mike Falk, I'm at Children's National Medical Center. I'm the former Director for Simulation at St. Luke's Roosevelt Hospital and Fellowship Director, and I'm the President-elect of the SIM Academy this year.
I am Mike Smith at Oxnard, New Orleans. I'm the Director for the SIM Center for our health system and past President of the SIM Academy.
I'm Kimberly Schertzer. I'm the SIM Director and SIM Fellowship Director at Stanford.
I'm Amanda Young. I'm at the University of Arkansas for Medical Sciences, and I'm the EM SIM Director.
Hi, I'm Mike Hrdy. I'm one of the Pediatric Emergency Medicine Fellows at Children's National.
Hey, I'm Patrick Hughes. I'm the Emergency Medicine Simulation Director at Florida Atlantic University in Boca Raton.
Hi, I'm Sara Hock. I'm the Emergency Medicine Sim Director at Rush Hospital in Chicago and the Sim Fellowship Director there.
I'm Ryan McKenna. I'm the Emergency Medicine Sim Director at University of South Florida, and I'm the Fellowship Director as well.
I'm Glenn Paetow from Hennepin County in Minneapolis, Minnesota, and the Sim Director there as well as the APD in Emergency Medicine.
I'm Miriam Kulkarni. I'm the Program Director at St. John's Riverside Hospital in Yonkers, New York.
Nur-Ain Nadir. I'm at Kaiser Permanente Central Valley. I'm the PD there and the SIM Director for EM.
Ernesto Romo, EM SIM Director at Washington University in St. Louis.
Hey guys, Charles Lay, Simulation Fellowship Director at Vanderbilt.
Mike Cassara, Simulation Fellowship Director, and many other hats over at Northwell Health, New York.
I'm Lauren Conlon. I'm the Program Director for Emergency Medicine at University of Pennsylvania and the ED SIM Director.
I'm Colleen Smith. I'm Associate Program Director for the Mount Sinai Emergency Medicine Residency Program in New York, and I have done a SIM Fellowship.
Did we get everybody? Awesome. So you guys have like a 1-to-1 instructor ratio today. It's fantastic. All right, so I'll take you through what's going to happen today. So we are going to start out today because we want to not only go through the fun procedures we have set up and take you through those stations, but we want to do an icebreaker because teaching procedures is not as simple as it appears. So we're going to start out with an icebreaker exercise with Legos. Some of you may have done it already. We're going to debrief on that. We'll take a quick break. Then as we're debriefing, we're going to have a nice presentation on best practices on teaching procedures. Short, I promise. I don't want everybody to get tired and sleepy. And then we'll take a break. And then we're going to split out into stations. And at each station, there's going to be challenges. And there's an amazing handout in front of you that as we go through the stations, we're going to look through. And we're going to present those challenges in teaching those procedures. If it's a procedure you want to practice and play with, too, is that a... Oh, okay. If it's a procedure you wanted to look at and play with and learn more about, that's fine too. We have instructors at every station, and some people are going to want to learn how to instruct, some people want to learn how to learn. So we will get started, I think. We'll get started with a Lego exercise. Sara Hock's going to give some instructions on this.
All right, hello. How many people have done a Lego exercise yourself or with a resident? So not that many. Excellent. What we'll do, and I'm not going to show you the exact structures because that's part of the exercise, but there's a baggie full of Lego parts, and there's a Lego construction. And the goal of the exercise is not actually the construction of the Lego house. I want somebody to do it. So there's going to be three people in each team. Person number 1 is going to have the pieces. Person number 2 is going to have the house, and person number 3 is going to be an observer. And the goal of this exercise is for person number 3 to share with the team and potentially practice, if we have enough time, the best techniques that they observe from person number 2, teaching person number 1 how to build the Lego house. So it's kind of an inception type of thing. But I'd like you to form groups of 3, and then each group will have a pair of Lego house and Lego pieces. Yes?
Just one thing I want to say, the person who's going to be explaining to, say, this person A, B, and C, A is actually doing the explaining of how to make the Lego house, B is the one who's making the Lego house, and C is the observer. A should be facing away.
Yeah, back to back.
The person who's making or building the Lego house. Because the idea is to verbalize how you create the house. And the observer is going to give feedback on how that went. So if you came back and relate that to your procedural skills, that's how you're relating and talking to the procedure. Okay, so the idea is not to visualize it, but actually using our speech and actually explaining it.
Perfect, thank you. The other thing I would say is that if we have enough time, once the first person has built the Lego house, the observer can then become the teacher for the second round, and in that moment can employ the techniques that they've seen be the most effective. And then after that, we'll talk specifically about the techniques that work for making your person build the right house, not so much about the experience of building the house. Does that sound good? All right. If you could kind of within yourselves form groups of 3, I will distribute the Legos to the groups.